Hello everyone, my name is Anuka Banjara. I am the FNP student at University of Texas at Arlington. Today I am going to do the comprehensive assessment of one of my patients in my clinic. So before starting my examination, this is my ID card. And before I start my examination, I am going to do the 360 of my room. So this is my room. These are all the supplies that I'm gonna use it in my examination. I have inch tape, measuring tape, watch, reflecthammer, tuning fork, otoscope, ophthalmoscope, otoscope, prints light, sun and eye chart. I have the two eye chart student and the e-chart. There is a water and hand sanitizer. Likewise, this is the room where I'll be doing the test. And he's my patient. Alright. So now I'm going to fix the camera. Before I start my already. So now I'm starting my video comprehensive assessment of the video recording. Hello sir.
Hi.
My name is Anuka Banjara. I am the nurse practitioner. I'll be taking care of you today, okay?
Okay.
So can you please tell me your name and how old are you?
I'm 24 years old and my name is Manil Thapa.
Alright, Mr. Manil. How can I help you today?
Like the yearly body checkup.
Yearly body checkup or annual examination.
Yeah.
Alright. So during the annual examination today, I'll be mainly focusing on your health comprehensive assessment that includes the examination from the head and will it in your toe, okay? Like we'll do the examination of all your body parts.
Okay.
Alright. So before you start my examination, is it okay to record your video, or I need the verbal consent to record your video in the comprehensive examination?
Okay.
Alright. So can you let me start with your mental status examination. Can you tell me what date is today?
8th August. 7th August 2019.
2019. Alright. Can you tell me who is the president?
Mr. Donald Trump.
Alright. Can you tell me where you are?
We are in Pflugerville right now.
How is your mood right now? Are you happy, sad?
Oh, I'm happy. I'm sad. I'm always happy, not sad.
Always happy. Alright. He's Mr. Manil Thapa. He is appropriate to his stated age, alert oriented times oriented to person, place and time. Well groomed, cooperative, pleasant, and good communication. Communicates effectively. He said the good mood which matches his effect. Okay, so now I'm going to start your examination from your skin. Can you show me your hands? Can you show me up your clothes like this? Alright. Alright, so looking at your skin looks brown in color, no any redness, erythema noted, no any lesions or scars noted in your skin. Okay, so before touching you, let me wash my hand. Alright, so I wash my hand. So let me touch your skin, okay? I'm going to touch the warmness of your skin and smoothness. You can just bring it right back. So his skin is warm, smooth and warm to touch. No any nodules present where I was touching his skin. Let me do the skin turgor. Okay, the skin turgor has instant recoil. It's intact and it's instant recoil. Let me look at your nail. Alright, so his nails looks equal length, symmetric. Equal length and symmetric bilaterally, pink in color, concave. Let me no any sinuses or scars or any masses present, no any abnormal growth present in the nails at this time. Can you do your nails like this? I'm looking at the clothing of your nails and there is no clothing present. Can you do all your fingers like that same way? Another one, third, fourth one, and the fifth one. Okay, no clogging present. Let me do the capillary refill test. I'm going to pinch your nail and it will be back soon. Okay, color, change the color. Alright. Alright, let me do it in your fingernails. So capillary refill is less than 2 seconds in all the nails bilaterally. Alright, so now let me start your hair. Okay, so talking about Mr. Manil hair, it is black in color. There is no any hair loss noted, evenly equal and evenly distributed in all of the hair and all of the head. No any sign and symptoms of inflammation or inflammations noted. No any lesions or scars noted. Let me palpate your scalp. Okay, so when I am palpating his scalp and the head, no any nodules or lesions or abnormal growth noted in the head. The head is the scalp is smooth but hard. Alright, let me go to your head. So the head is normocephalic. It is in midline it is in midline upright position, is still upright position. The facial all the, can you look at me? All the facial features look symmetrical. No any sign and symptoms of infection or erythema noted over there in the head. Let me go to your neck. The next the neck is in midline position. Let me look at your trachea. The trachea is in midline position. No nail heaviness or any thyromegaly present. Let me palpate your thyroid. Okay. No any masses or bruise present when palpating the thyroid. Let me palpate your carotid pulse. Alright. The carotid pulse is palpable in both sides and is like regular rate and rhythm. No any bruits or masses present. Let me auscultate your carotid pulse and then also the thyroid. Okay, let me palpate the thyroid first. Now I'm palpating the carotid. I mean auscultating the carotid artery. As I told you before, no any bruise or masses or thrill presence when I'm palpating the thyroid, as well as when I'm palpating the when I'm auscultating the carotid artery and the thyroid. Alright, then I'm going to give you a water. You just swallow it. Okay, so, okay, can you swallow it? So the trachea moves upward when he drinks the water. That means it's normal. Now let me do his lymph nodes. Okay, so mainly when I am doing the lymph nodes, I will be starting from the back. If you feel any tenderness or tenderness or pain, let me know. Okay, then I'm starting from occipital, preauricular, postauricular, and then tonsillar, submental, submandibular, anterior cervical, posterior cervical, supraclavicular. Can you raise your hands? Then axillary lymph nodes, and then the epitrochlear. So when I am palpating his lymph nodes, like occipital, supraclavicular, occipital, preauricular, postauricular, supraclavicular, tonsillar, submandibular, submental, axillary, and the epitroclear lymph nodes. There is no any tenderness or masses present when I'm palpating it. Head, neck, and limbs. Alright, so it is my head, neck, and limbs, and now let me go to his eye. Okay, so when we starting my eye checkup, let me inspect his eye. The both of the eyelids look symmetrical, equal distribution of the eyelashes and then the eyebrows. Let me can you touch this one for me? Okay, let me palpate your eye. Any pain, any tenderness noted? So no any pain or tenderness noted when I'm palpating the eye. The eyeball looks round in color. So let me start the eye checkup. So like we will do the visual acuity test with the two different kind of eye charts. Actually, the Rosenberg and for the near side vision, and the Snellen charts for the far sightedness. So let me do the Snellen chart first. Okay, can you do you use any lenses?
No.
Any glasses? No. Okay, so can you close your one eye and read the letter? It should be like 20 feet distance for the Snellen chart, and patient should be able to read out the object, read out the letter, starting from the top to the bottom. What is the top one?
E.
E. Okay, can you read in the 8th line? What is this one?
D. E. F.
Okay.
P. O. T. E. C.
Okay, so his according to the Snellen chart, his vision, he's able to read the 8th line, means his vision is 20 by 20. Can you close the right eye and look at the left one?
Number 8. D. E. F. Let me do. D. E. F. O. T. E. C.
All right. So from the left eye also, closing the right eye, he is able to read out the 8th object. That means the vision is 20 by 20. Far side vision is 20 by 20. Let me do it for the E chart, and E chart, like he should be able to read this for the near side business, and it should be like 1.6 centimeter, at least like 1.6 centimeter distance. So can you tell me which side it is, like up and down?
E on this side, E on down, E on this side.
This side, okay. Can you read me on the 8th line?
E on this side.
No, actually, can you close your one eye?
Oh, sorry. Okay.
Left eye, right eye. 8th one.
E on this side, facing on this side, facing on up, facing on this side, facing up.
Facing up. Okay. Can you close the left eye, right eye, and look from your left eye? The same thing.
Number 8.
Yes.
E on this side, E on this side, E on up, E on this side, E
left
on up.
and up. All right. So he's able to read the line 8th in the E chart also, which means that his near vision is also intact, and no any problem with the vision. Okay. So now let me look at your. Can you see down? Okay, I'm looking at the conjunctiva. Let me look at your up. So when I am inspecting his eye, the conjunctiva is white in color, sclera is white in color, iris is brown in color, the lacrimal lens are clear, the lacrimal apparatus is soft, and there is no any exudate or drainage present or erythema present at this time. Okay. Now let me do the let me check his pupil. So just look towards me. Okay, look in the in the front. It's the direct and consensual, and again the direct, and look in the front. Again the direct and the consensual. All right. So the pupil is and okay. So can you focus on this one and just look at where the object is? Okay. Okay. So the pupil is equal in both of the eyes, equal, round and reactive, and accommodates accordingly bilaterally. Okay. Now let me do the like cardinal fields, the 6 cardinal fields. You will be just following this one, okay? Where I move the finger already, like in 2 feet distance. This is for left up, left down, center, and the right side, right up, center, right down. So he is able to follow in all 6 fields, 6 cardinal fields. Like 6 cardinal fields intact. EOMI is intact. Alright, now let me do the fundoscopic or the ophthalmoscopic evaluation of the eye. When I'm doing that, you will just look at the front, okay, sir? In the ophthalmoscopic evaluation, let me go from the eye. In all the eye, told you before, eyelashes equal. There is no any erythema redness present. I can see the red blood vessels inside the eye or in the conjunctiva. No any rupture of the blood vessels noted. In the red side, and red reflex is present. And let me do it on your left one with my left hand. Already, just you can just look at me, okay? I told you before. There is no any redness, erythema rotated. I can see the small blood vessels without any rupture or erythema in the conjunctiva, and the red reflex is present. And then at the same time, I will do the corneal reflex also. And the corneal reflex is also present. Now let me do the cover-uncover test. So you're just gonna follow my finger and you're gonna tell me how many fingers.
2, 1, 3.
Okay, then I'm going to cover the left eye and the right eye.
2, 1, 1, 1.
Alright, so he is the uncover test also. He's able to figure how many fingers I have. That means it's intact. Okay, so when I'm doing the eye checkup, I cover the cranial nerves 3, 4th, and 5th, which is 3, 4th, and 6th, which is the motor function. That means oculomotor, trochlear, and abducens. Oculomotor is 3rd, trochlear is 4th, and and the abducens is 5 with the motor functions. That means he is able to the pupils is equal, round, and reactive to light, and accommodates accordingly. 6 cardinal fields intact without any nystagmus or tics present. And a corneal reflex present, and it covers the corneal 3 different cranial nerves also. Now let me go towards his nose. The nose looks symmetrical. The nose is in midline position. No septal defect noted at this time. It is smooth. No any scars or redness present in the nose. Let me do the let me check his nose from the otoscope. Okay, so I have a cover of the otoscope cover, and it is otoscope. Already, so I'm going to look at your nose, okay? And that first in the right ears. The mucosa inside the nose is pink in color. Fine hairs present. No any drainage noted. No any lesions, erythema, or exudates noted. Let me look at your left side. It's the same thing. Fine hairs present. Redness, pink in color. The mucosa pink in nasal mucosa pink in color. No any redness, erythema noted. No any lesions or nodules present on the neck. And no any septal defect. Alright, so let me go to your ear. Talking about your ear, the ear looks symmetrical in both of the ears. No redness, erythema noted. No any drainage noted outside of the ear and the outer canal. Let me see the intercanthus. Check the outer canthus to the pinna is up, that means normal. Let me look at the right side also, it's same, it's normal for the normal human being. I can just twist a little bit on this side so that I can already. Let me see. Yeah, that means it's easier. So I can see it now. I'm going to do the otoscopic examination. I'm going to see the otoscopic examination of my 43. Otoscopic examination in the right ear in the beginning first. Let me change this one. I'm going to change the there is cover and the otoscope. Let me put the cover of the otoscope, and I'm going to do the right ear up and the back for the adult person. The inside the ear and I can see the internal canal very good. I can visualize the internal canal. There is no any redness or erythema noted, no any swellings or discharges present. Bony prominence intact, no any bulging or retraction present, no any cerumen present. Tympanic membrane is purely gray without any sign and symptoms of infection. Let me do it in the left ear. And the right cone of light is at 5 o'clock. And let me do it in left ear. Is the so in the left ear I can see some cerumen present, no any lymph no any nodules present, no any lesions or masses present, fine hair present. The bony prominence intact without any bulging or retraction. Tympanic membrane purely gray in color. No any discharges present in the ear. So let me do the now let me do the whisper test, and this test will also cover the cranial nerve 8th, that means vestibulocochlear. Okay. So I'm going to stand in 2 feet distance and repeat, tell the 2 words, and you should be able to tell me 2 words. You have to close the one ear at one time. Okay, you can close the left ear, and I'm going to whisper 2 words.
Red apple.
Okay, they close your left ear and
the red apple.
okay, so he is able to tell me the whisper sounds. That means he's hearing sense, there is no any problem, it's intact. So it also covers the cranial nerve as 8, that means vestibulocochlear, which has the sensory function. Already, so let me can see the mouth and throat. Okay, so let me see your lips. The lips is pink in color, no any lips, there is no any scars or sinuses present in the lips. Any pain?
No.
Okay, no any pain. I cannot see any feel any nodules or anything from outside. Can you open your mouth for me, please? So looking at his mouth, the palate looks pink in color, the buccal mucosa looks pink in color, no sign and symptoms of infection present, no redness noted. The tongue is pink in color, the mouth floor is pink in color without any sign and symptoms of infection, no sinuses present. Dental caries present in the upper teeth on both of the side, but all the teeth are present, all 32 teeth are present. Can you say ah to me? Take your tongues out and say ah. When he said ah, the uvula moves up, and that's normal. There is no any sign and symptoms of infection noted, no any swelling noted. Let me look at your tonsils one again. Can you open your mouth for me? Talking about the tonsils, both the tonsil size is 2+ by 4+ bilaterally, no any sign and symptoms of infection noted, no any redness or erythema noted in the tongue. Alright, so I am going to do your Now you have to do the chest. Okay, so
Okay.
can you remove your clothes for me?
Like the whole shirt?
Yeah. Okay.
I got it.
Alright. So, going about his chest examination. Let me see if a camera can see his. Okay. The chest. So we'll do the chest. Like we'll listen the long sounds also. Okay. So when it's inspection, it just looks. There is no any, let's say the skin looks intact, no any scars, any bruises or any redness present, no any sinuses present, like it was no any sinus noted in his nails also, no any the breathing looks breathing is 16 breaths per minute is a regular rate and rhythm. There is no any accessory muscles used for the breathing. There is even and equal bilaterally. Alright, so let me auscultate your lung sounds. Okay, auscultate your lungs. Okay, so I'm gonna auscultate in second space and all the sounds. Okay, I'm going to see if there is any dullness present or not. If dullness is present, means there is something wrong. Okay, left, right, intercostal space, fourth, fifth, lateral. So no any dullness present when I'm percussing the anteriorly. Let me auscultate the percuss. You can front in your back like this way, so that we can see in the camera. Already. Alright. So no any dullness present when I am percussing his lungs. So now let me auscultate his long breathing sounds. Can you move in the front? Turn towards the front. So excuse me. I'm going to auscultate the bronchial sounds, which is heart over trachea. Can you take a deep breath? In the bronchial sound, the expiration is greater than inspiration. Now let me do the bronchovesicular, second intercostal space, left and right. So right. Okay, take a deep breath. So the bronchovesicular sounds, expiration is equal to inspiration. Let me do the third intercostal space. Take a deep breath in and out. Keep doing it. Alright, the vesicular sounds in the lung periphery. Can you turn to in this side in the back? Okay, so when I auscultate the lung sounds, like breathing sounds, bronchial sounds, is like you can front in the front. The bronchial sound, the expiration is greater than inspiration. Bronchovesicular, second right, this equal. Expiration is equal to inspiration, and the vesiculars in the other lungs, other parts of the lungs is the vesicular sound. Inspiration is greater than expiration, and no any adventitious breath sounds such as wheezing, core sounds, rails, or rhonchi noted. So the lungs is clear. Lung sound is clear in auscultation. So let me go towards his heart. Now you're talking about the heart examination. We have to do the heart examination in 3 different positions: sitting, lying, and supine position. So right now I will be mainly doing in the sitting position, and when I'm doing the sitting position, so let me see his heart sound. It's like the heart, there is no any It looks no, there is a symmetrical expansion in the chest, no any redness, scars or anything noted in the skin. Let me palpate his precordium. So no any pulsation, any hips or thrust noted. Now I'm going to auscultate your and let me palpate his apical pulses. So first, second, third, and fifth. Let me palpate his apical pulse. The apical pulse is 76 beats per minute. No any thrills or bursts presents at this time. Let me auscultate the heart sound, and we're gonna auscultate the apical pulse once again with the diaphragm. And talking about the auscultation, the main difference between the diaphragm and the bell is we can hear the diaphragm. We can hear the low tone, low frequency sounds from the bell, whereas we cannot hear the low frequency sound from the diaphragm. Actually, diaphragm filters the low frequency sound, but I'm using the diaphragm at this time to listen the heart sound. So starting the heart sound, we'll do the second intercostal space left and right. Second intercostal space right is aortic, left aortic, pulmonic. So let me do the second intercostal space right, which is pulmonic. Second intercostal space left. In second intercostal left and right, the S2 is greater than S1. Third intercostal space, ops point. S1 is equal to S2. Fourth intercostal space, tricuspid. S1 is greater than S2, and the fifth intercostal space, mitral. S1 is greater than S2, and I can listen the apical pulse also at the same time. It's equal, I mean it's like regular rate and rhythm without any bursts or thrills present. So and there is no any splits or murmurs or abnormal heart sound present when I am auscultating the mitral valve or all the heart sounds. Alright, so let me fix this seat so that we can lay back down, sir. Maybe we can see it here.
Just to lay down.
Yeah, let me fix the camera first if I can.
Lay down.
Yeah.
Straight.
Just face your face on that side. Like no, like face on the other
face
side.
on this side.
Opposite way. Face on the opposite way. Yeah. Okay, can you lay down? Already, yeah. Okay, I can see it now. Okay. Can you turn on your left? Can you turn on your left for a little bit, so that I can listen the
This way or this way?
This way. Yeah.
Like this?
Yeah.
Okay.
I am going to see apical pulse. Okay. Okay. All right. So talking about I can understand. Talking about apical pulse is like rate and rhythm. It's 76 beats per minute. It's regular with no any. Now I'm going to do your long sound, heart sound in the supine position. Second intercourse is left and right. Right first, pulmonic, aortic. S2 is greater than S1. Third intercostal space, tricuspid. I mean like ops point. S1 is equal to S2. Fourth intercostal space, tricuspid. S2 is greater than S1, and then the mitral in the fifth intercostal space. S1 is greater than S2, and let me see the apical pulse. I can still hear the apical pulse, regular rate and rhythm, without any splitting, murmurs, or any friction rubs. Alright, so let me check his pulse whenever you are you comfortable?
Yes.
Okay, I'm going to check your pulse at the same time, okay?
Okay.
Since you don't have to stand up. It's temporal. I can feel the temporal pulse, then carotid. Okay, you put it bilaterally. Your brachial, in the both the hands. Alright, your radial pulse. Okay, can you just move your legs a little bit up? Your dorsalis pedis, posterior tibialis, and the dorsalis pedis in the front. Alright, I can feel all the pulses, and it's regular, with a regular rate and rhythm. All the pulses are palpable, 2 plus by 4 plus equal bilaterally. Alright, now I'm going to do your abdomen. Let me see if I can cover the abdomen. Yeah. Okay. So can you move your hands here? The abdomen is round, like it's flat counter, fine hairs present, no any scars, bruises noted, no any cyanosis or redness present. Let me auscultate your bowel sound first, okay, before we do anything. So I'm going to listen to bowel sounds. I'm going to start it from left upper quadrant. Okay, so bowel sounds present. Right upper quadrant. Right lower quadrant. And left upper lower quadrant. Epigastric region. Alright, so there is the active bowel sounds presents on all 4 quadrants and epigastric region. Now I am going to percuss your abdomen, okay? No any dullness present when I am percussing the abdomen. So now let me percuss the liver. Okay, when I'm percussing the liver, let me mark it down also. Alright, I'm percussing the liver now, going from the downward in your right side. Okay, so I can hear it here. Can you place your, I'm sorry, can you place your hand like this here? Okay, I'm going from upward. Okay, so up to here. So let me measure with the measuring tape. It's like 8 centimeter. And 8 centimeter, that's the normal for normal human being. There is no, without any hepatomegaly and masses present. Can you turn? Can you turn on your left? I mean on your right side, so that I can.
This side?
Yeah, a little bit. I am going to do palpate and percuss the spleen on the left side from the mid-axillary line. You can lay back on your back. So the
Straight?
yeah. So yeah, lay on your back on your straight. I'm sorry about that. So the splenic dullness. No, back on your back.
Like
Splenic, yeah, splenic. No, on your back. Whole back.
Oh,
This
whole
back.
back.
Yeah. No, lay on your back. Not your abdomen. Splenic dullness
This one?
present. Yeah, splenic dullness present. between the 6 to the 10 intercostal space on the lateral position in the mid-axillary line. So now let me palpate your abdomen. When I'm palpating your abdomen, I'll palpate in all 4 quadrants, okay? Starting from the, I'll do the superficial and deep. Superficial will be 2 and the deep will be 5, okay? Let me know if you feel any tenderness. I'm doing the superficial right now. Just little uncomfortable. Any pain or anything? Okay, now I'm going to do the deep palpation, okay? It will be like 4 to 5 centimeter deep. Do you notice any pain or any tenderness? Anything noted when I'm palpating? Alright, so you can sit up. So when I palpate the abdomen, there is no any tenderness or pain present, and no any masses or lesions noted when I was palpating it. Already. So now I am going to do the musculoskeletal. When I'm doing the musculoskeletal, I have to make you stand up. You have to stand up also, okay? So can you just walk a little bit, like go over there on that side and come on this side for me, and come towards on this side. Okay, so looking at his, looking at his posture, he is like straight, and there is no any normal gait, no any abnormalities noted when he is walking. Normal gait and regular posture. So we'll do the range of motion from like active and passive. I will do one and you will do once, okay? Range of motion exercises, we'll start it from your spine. When we are doing your spine, so can you let me see, yeah, can you shrug your head like this? Okay, alright, you can go ahead. So I will do the first, okay? So it's a spine flexion, extension, hyperextension, external rotation, internal rotation. Can you do the same thing? Flexion, extension, up, look at me and you can do the same thing. Hyperextension, external rotation. So the spine, he can move his neck without any problem and any difficulty. So like soldier now, it's the same thing. Let me do it. Let me do it for you. Okay. So soldier, extension, hyperextension, and then abduction and adduction, and then upward. Okay, and let me do it in the same one. Okay, flexion, extension, hyperextension, abduction and adduction. Alright, can you do it in the same way? Yeah, like the same way. Hyperextension and then adduction and extension. Okay, and the same another one. Flexion, extension, hyperextension, front, abduction and adduction. Alright, so he can move his shoulder. Let me do it the elbow. Flexion, extension, hyperextension, abduction, adduction. Same thing, okay? Flexion, extension, hyperextension, and extension. Can you do that for me by yourself? Flexion, extension, hyperextension, internal rotation, and external. Already, the elbow. Okay. So you can move his elbow. Talking about the wrist, it's the same thing. Okay, wrist, flexion, extension, hyperextension, eversion, inversion, and the rotation. Same thing. Flexion, extension, hyperextension, inversion, and rotation. Can you do it for me? Rotation. Okay, another one. And rotation. All right. Can you do the finger? Finger also. Okay. Finger also same thing. Flexion, extension, hyperextension, and the rotation. Flexion, extension, hyperextension, rotation, and the inversion. All right. Can you do it by yourself? Okay, hold on, follow me. Straight, flexion, extension, hyperextension, rotation, okay, exversion and inversion. Alright. Okay, about your knee, can I see your knee? Okay, I can still see your knee. Okay, so it can your knee, flexion, extension, hyperextension, rotation, and rotation. Same thing. Flexion, extension, hyperextension. I cannot do it alone. Okay, can you do it by yourself? Flexion, extension, hyperextension, and then that's fine. Okay, this one. Flexion, extension, hyperextension. Okay, so he can move his knee without any problem. Let me see if I can see your okay, let me go to your neck. Okay, ankle now. So it's the same thing for the ankle. Okay, flexion, extension, inversion, extroversion, and the rotation. All right, and the same thing. Okay, flexion, extension, inversion, exversion. Can you do it? Flexion, extension, extension, and then internal rotation. Like you can follow me. Okay, flexion, extension, hyperextension, inversion, exversion. Like the same. Another one. Flexion, inversion, exversion, and rotation. All right. So talking about the range of motion in the spine, shoulder, ankle, wrist, finger, knee, and ankle, elbow, and he can move his extremity without any problem. That means it's normal for his age and developmental growth. Can you stand up for me? Already. So just turn towards the back. I am going to check the scoliosis test on you. Okay. So let me. So your finger. Can you move your shoulder for me? Okay. Back here. It's symmetrical. Already the waist is symmetrical. The back is shoulders look symmetrical. Can you bend yourself and touch your finger and toe finger, and slowly move up, up. Okay, so when yeah, good. So when he is moving, there is no the scoliosis test done as it's negative, since he is able to bend his spine and touch his finger toes and able to get back in normal position without any curvature or any noted in his back spine. All right, so now this is the musculoskeletal. Now let me do his cranial nerves. So talking about the cranial nerves, there are 12 cranial nerves. Some have motor function, some have sensory, and some have both of them. The first is the olfactory. It's mainly for it's a sensory function, and it is for smell. So I'm not going to do that one right now because I don't have anything that can smell. Or we can smell this one too. Okay. Can you smell?
Mm-hmm.
What is this one? Can you tell me?
Like antiseptic.
All right. So his olfactory is intact. Now optic is also the sensory function, and he was able to read read the Snellen chart before, and I'm going to touch it.
Left, right.
Right.
Left, right.
Okay. So as I told you, it's mainly for sensory. He has a sensation in his eye, and like we did the Snellen charts before, and he was able to read the distant vision, and from the Rosenberg he was able to read the near vision. So his vision is intact vision is intact, and it's 20 by 20. And then talking about the sensory nerve 3, 4th, and 6 is both have the function related to the eye. All of the third is oculomotor, 4th is trochlear, and 5th is and the 6th is abducens. All of them have the motor functions and related to eye. And I did the examination when I was doing the eye examination. That means for the pupils is equal reactive to round and reactive and accommodation intact, and likewise his 6 cardinal fields intact without EOMI, without any nystagmus or tics present. Has a sensory function, and he was able to read the Snellen charts and the Rosenberg charts without any problem. Alright, so talking about the 5 trigeminal, it have both sensory and the motor functions, sensory and motor functions trigeminal. So talking about the sensory function, I'm going to touch this. Which side I'm touching?
Left, right.
Which one? Right.
Left.
Okay, so he's able to tell me which side I am touching. And now can you open your mouth for me towards my hand? Okay, just force my hands towards down, like this. Okay, alright, so he's forcing towards my hand. That means his motor function is intact also. Now the cranial nerve 6, I already told you. Cranial nerve 7 is the facial nerve. It have both motor and sensory functions. Talking about the sensory, cranial nerve facial nerve should be able to have the anterior 1/3 with the sense of sugar and sweet and salt. They can feel sweet and salt in the sensation. And like talking about the motor function, for the facial, can you smile? Can you show your teeth? You don't have to show me. You can show your teeth. Okay. Can you pout? Okay. Can you raise your eyebrows? Okay, eyebrows. Okay, so he's able to do like smile, so the straight, frown, pokes, and raise the eyebrows. That means his motor function is also intact. Facial nerves. 7, 8 is vestibulocochlear, and I did while I doing the hearing test, the whisper test, like in the 2 centimeter distance, and he was able to repeat the 2 words from closing 1 ear at a time. And it was intact. He was able to tell me both the object. That means the auditory sensation is intact. And the vestibulocochlear is mainly for the sensory. Now the 9 is glossopharyngeal, and the 10th glossopharyngeal, and 10th is vagus. Both of them have the sensory and motor function. So glossopharyngeal, like I did it before, like when I did it before, he was able to move his tongue outside, and then when I look at the uvula, when I tell the word R, he was able to tell R, and the uvula moves up. That means it's intact. And then like the sensory is posterior to third, like he will be able to taste the sour and bitter in the posterior to third. And talking about the vagus, let me do the gag reflex. Okay, can you open your mouth for me? Okay, I'm sorry about that. So his gag reflex is intact. So talking about the sensory nerve, cranial nerves 11, it is the accessory, and accessory can you and it has the motor functions. Motor functions, can you shrug your shoulder again? Okay, can you turn your face like her? Okay, can you push my hand over there? Okay, on this side. Okay, so he has his accessory, both the accessory, he is able to push towards me and shrug his shoulders. That means that has accessory cranial nerves. Cranial nerve 11, which has the motor function, is intact. Cranial nerves 12 is the hypoglossal. It has the motor functions mainly related to the tongue. Can you take your tongue out and move like up and down, up and down, up, down. So that means he is able to move his tongue up and down, side by side. That means the cranial nerves 12 is intact. The hypoglossal, which has the motor function, is intact. Now I'm going to the coordination test. Like you can do the rapid movement according to my hand. Okay, like this. So he has the equal and bilateral coordination is rapid alternating coordination by equal bilaterally. So like finger to nose test. Okay, you're gonna touch my hand and touch your finger. Touch my hand, touch your finger. Okay, touch my finger, touch your nose, touch my finger, touch your nose. So finger to nose test, there is no any nystagmus or tics present when he is touching from my finger to nose. Now it's a coordination. Now I'm going to do the sensory sensation. Close your eyes. Where I'm touching?
Left arm.
It's a hand or face?
Left arm.
Left arm. Okay. Where am I touching?
Left.
Where am I touching?
Right.
Okay. Where am I touching?
Left. Sorry, right knee. Left.
Okay. And now I'm going to do the vibration. Okay, you can close your eye. So vibration noted. All right. So he has a sensation to all the extremities, and he is a vibration. He can feel the vibration in the both upper and lower extremities. Now I am going to do the reflexes. So talking about reflexes, I am going to bicep, tricep. Let me do the biceps first. Just really, let's feel free. Okay, don't feel it. Feel free. Okay, like the this one man. Okay, and then biceps, then triceps. You can relax your hand. Okay, just relax your hand. Okay, it's the triceps, and then brachioradialis. Already, so the brachioradialis reflex is present. Can you release your legs? Let me see if you can see it. Again, we can see it. Okay, let me do this one first. Okay. Patellar reflex is present. Let me do the acheilles. You can turn. Okay, I can do it from this side. Okay. Acheilles reflex. Okay. Alright, and then the plantar. Okay, so the plantar reflex is present, and no balance to reflex. Already, so I think that ends our physical examination from head to toe. Okay, thank you for being patient with me.
Thank you.
You can put your clothes on.
Thanks.
And thank you so much.
Thank you.